Hello everyone, my name is Dr. Huzefa. I am a physician at Hamilton Valley Hospital. Today I want to speak about dengue infections. Usually we see dengue virus infections during the summer months, immediately after the rains. What happens is when the water is collected in various areas, small things like cups or anywhere in the garbage, the water gets collected, the mosquito starts breeding, and once the mosquito starts breeding, they tend to bite during the daytime. The mosquito name is Aedes aegypti mosquito, and the dengue virus multiplies in this mosquito and they bite during the daytime. What happens in dengue virus is once the person is bitten, they start developing fever after 4 to 5 days. They develop high degree of fever like 103, 104 Fahrenheit. And they also develop severe body pain, joint pains. They also develop vomiting, nausea, and there will be a lot of dehydration. And they'll have weakness, giddiness. And due to nausea and vomiting, they are not able to take fluids properly, so they develop low blood pressure also. So once they come to the hospital and we find that they are having fever, we check for dengue virus, and once the dengue antibodies or antigen are positive, then we check the complete blood count, that is total count and platelets. What happens in dengue is around 50% of the people, the platelets reduce. So normal platelet count is around 1.5 lakh, but in dengue virus it will come down from 1.5, it can even go down to as low as 20,000 to 10,000 or even 5,000. But once, if they come early, they are completely treatable, completely curable. But if they delay, if there is a delay of many days, they develop shock, dengue shock or dengue hemorrhagic syndrome. What happens in shock is they develop extremely low blood pressure due to leakage of the plasma in the body. So they develop fluid in the abdomen, they develop fluid in the lungs, they have breathing difficulty. And in dengue hemorrhagic syndrome, they tend to develop bleeding in the various areas of the body like gums, the nose and in the abdomen. Most of the time the patients can be treated on OPD basis. They have to take a lot of fluids, lot of oral fluids. That is the main treatment, and we'll give them medicines to prevent the nausea and vomiting, and they tend to recover. But once the platelet reduces, like if it is less than 50,000, it's better to get admitted and monitor the platelets in the hospital. And mainly we give them IV fluids to maintain the blood pressure. We give them injections to prevent vomiting. And once they start taking orally a lot of fluids, they tend to recover. And there is nothing to worry about the dengue. It can be treated. And if the platelet reduces to less than 20,000, there is platelets available for transfusion. And once you transfuse that, the platelet levels improve. And it's a process by which the body recovers on its own. Within 5 to 7 days, the platelet starts improving, and we can discharge the patient home. So friends, I just want to tell that once you develop fever, dengue fever, you take a lot of fluids orally. That is the mainstay of the treatment. Take a lot of fluids, water, juice, coconut water, and take paracetamol, and you will recover. Thank you so much.